It's my pleasure to present at aortic on our study Gynecologic Cancer Treatment Toxicities and Relationships with the Vaginal Microbiome in African American Women. My name is Deborah Watkins Bruner. I'm presenting on behalf of our team listed here, which includes Emory and Georgia Tech faculty. The aim of this study was to look at differences in the vaginal microbiome between GYN and healthy age-matched African American women using 16S RNA and to identify associations between the vaginal microbiome structure and dynamics with symptom manifestation and persistence of symptoms. Our population is there on the right. This is a sub-study of a larger study where we only look in this study at our African American subjects. They were matched well on age. We had 34 cancer patients, 33 healthy, and the average age was about 58 years. There was a higher BMI in our cancer patients, not surprising, as that is a risk factor for particularly endometrial cancer, of which we had 59%. And all patients were treated with either radiation alone or radiation chemo in the GYN cohort. As part of background, we know that African American women in the United States have poorer outcomes compared to whites, including a 98% higher death rate due to endometrial cancer and a 50% higher death rate associated with cervical cancer. We know that our GYN cancer patients, survivors, have symptoms that last for decades. 2/3 live with these symptoms post-treatment. Radiation therapy in particular, and all of our patients had radiation, is associated with significant symptoms post-treatment. And we do know that the vaginal microbiome contributes to symptoms even in healthy women, especially when they become postmenopausal. They change what is known as community state types from a very healthy type A, lactobacillus dominated community to a less healthy environment with non-lactobacillus dominance. And we call that community state type 4. And this is pre-cancer. This state is associated with risks of infection, urinary tract infections, and sexually transmitted diseases. We know that radiation and changes in the vaginal microbiome may interact with local immune factors to make the vaginal environment even less healthy. And we know that even pre-treatment or in healthy women, premenopausal, there are significant differences between the African American and the white vaginal microbiome. So most studies in the literature comparing African American GYN cancer patients to white cancer patients, and that does not help us with targeted therapy, which is why we're targeting, looking very specifically at African American GYN patients and their controls. And our methods included a time series from pre-treatment up to 1 year. We had matching a cohort of healthy women. We did vaginal swabs at all 4 time periods. We used 16S RNA to do the sequencing. And then we looked at both alpha and beta diversity and stability. And at the bottom, you'll see the metadata we included in this analysis. Our symptoms, on the right, what you see is green is our healthy, red to pink is our cancer patients. The darkest red is T0 or pre-treatment, and then the colors for the cancer patients get lighter as we move up to 1 year. Over time, you can see a vast difference between the green and the red patterns, showing a significant difference between healthy and cancer patients. And this at the top is clinician or physician reported symptoms. At the bottom, what we have is the same color scheme. Green is healthy, red is cancer, and you see significant difference in patterns between healthy and cancer patients in their patient-reported symptoms. We're also seeing that cancer patients have at least one symptom over time, and that's 50% versus 30% in the healthy cohort. And cancer patients have almost 25% have persistent symptoms over time versus only 12% in our healthy cohort. This shows what we call community state types. And the most important thing is to look at, on the far left, the healthy state, which is lactobacillus, that's what the pig means, dominated, over to where we see many of our cancer patients moving to state type G or 4 over here. That is the more dysbiotic, has much more diversity, which is bad compared to this normal state. And that's where our cancer patients start to move over time. 43% of African-American GYN cancer patients moved from one community state type to another over time versus only 15% of our healthy African-American age-matched controls. And what we see is a definite pattern of more opportunistic pathogens in a dysbiotic vagina. In terms of diversity, these are box plots. Red is cancer, green is healthy. And again, over time, you're seeing much more diversity in the cancer patients, and diversity in a vaginal environment is actually bad. Here we compare our stability over time. The red is again cancer, green is healthy in our cohort, and you see that over time, our cancer patients have a more unstable vaginal microbiome. This is a comparison to the literature. As I mentioned, the literature is sparse. These two studies include 40 to 50% African Americans, and you can also see that they have much lower diversity, which is much more healthy compared to our cancer patients. Looking finally at the community state types, in particular patients, what we see in our cancer patients over time is that there's an association between a lack of lactobacillus and dryness, between some of the opportunistic pathogens and both dryness, vaginal pain, and also lack of lubrication. And finally, our conclusions are that cancer and treatments have a detectable effect on the vaginal microbiome of African-American GYN patients up to 1 year after therapies compared to our African-American age-matched healthy controls. And we need to move to next steps because 16S does not give us strain level resolution. It also does not help us understand function, and that's where our studies are moving. It also may be that the changes in vaginal microbiome are associated with HPV persistence and disease progression, and we'll be looking at that in our next steps. So the vaginal microbiome may become a new biomarker for GYN cancer outcomes and help direct therapy. Thank you.